Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Bronwen Carroll. She's a pediatric emergency medicine physician. Today's Kevin MD article is The Childhood Risk We Never Talk About. Bronwen, welcome to the show.
Thanks for having me.
All right. So before talking about the article, just briefly share your story, then we'll jump right into the article you wrote for us on Kevin MD.
Sure. So I'm a pediatric emergency medicine physician, as you said. And through the nature of my work, I see children who've been sexually abused, sexually assaulted in the ER. I think that what most people don't realize is sexual assault is the most common, really bad thing to happen to children by far. About 10% of kids at a minimum are sexually assaulted before they're 18. So I've always known that professionally. And of course, I speak to my own children at home about protecting themselves and staying safe. But I never really thought about what other families did. My daughter's teacher was arrested for possession of child sexual abuse materials. And after that happened, the head of school invited me to speak at a community forum, which involved the sex crimes unit, which had led the investigation leading to the arrest, the DA's office that would be prosecuting the case. And then my role was to speak to parents about how to address this event with children. This is a pre-K through 12 school. And so obviously that's a wide developmental range. And this is a difficult topic for anyone to speak about, but certainly parents. And so it's also a very broad umbrella. So when we talk about kids and sexual abuse, that covers a lot of things. That covers child predators, but that also covers online predators and exploitation and sexploitation. And that covers just how do you speak to your children about pornography. So I gave my talk. And I went home. And in the subsequent 48 hours, I was absolutely overwhelmed by parents reaching out to me. And they all said a version of the same thing, which is that nobody had ever raised any of this with them before. And I just found that shocking. And so for me, it was this moment when you see something in a completely new way. And after that, I couldn't just go back to business as usual.
All right. And you wrote this Kevin MD article. Tell us about this article for those who didn't get a chance to read it.
Sure. So as I said, sexual assault is overwhelmingly the most common, seriously bad thing that happens to kids. And yet, parents receive almost no guidance on what to say to their children, how to say it. You know, we talk about car seats and drowning and all kinds of other safety, obviously, extremely, extremely important. But this big bad thing doesn't get discussed. And the thing that I want people to realize the most is child predators are completely predictable. They are like a football team with a single play. And if we can just teach families and children to recognize and defend the play, you can change the face of a public health crisis that is largely not being addressed.
All right. So tell us some of the things parents need to know because, like you said, sexual abuse can manifest in many forms, but what will be the key things parents need to be aware of that you teach them?
Sure. So, for sexual abuse to occur, child predators need three things. They need access to a child, they need compliance from that child, and they need secrecy. So, parents need to take a three-prong approach to keeping their kids safe. Step one is the access to a child. And there are two pieces of that. One is parents really need to be aware who is with their child, who is alone with their child, and make themselves as parents a visible presence. Now, when I say that, I don't mean that parents need to be at every single thing. I'm a mom, I have 4 kids, I have a job. I'm certainly not at every single thing. However, predators, child predators, choose their victims carefully. And one of the things that they look for is kids whom they perceive as having low parental involvement. So simply by introducing yourself to the coach, dropping in on the babysitter, saying hi to the teacher, you're keeping an eye on who's with your child and you're making yourself a visible presence. Predators also select kids whom they perceive as having low self-esteem and needing attention. Now, obviously, we should all be building kids' self-esteem aside from all of this, just because it's a good and important thing to do. But helping our children move through the world with confidence also keeps them safe. Then the next thing that predators need is predators need compliance from kids. Sexual assault is almost always occurs in the context of people whom children know. So when I was a kid, we were all warned about the creepy stranger asking you to pet a
Mhm.
puppy from a van. That isn't who's assaulting kids. Who's assaulting kids is the favorite coach, the trusted teacher, the beloved member of the clergy. And the way that this works is generally through a predictable grooming process in which predators test children for compliance. So we need to train our children to recognize these behaviors, to disclose them to us, and essentially to fail these tests. So what predators tend to do is they single kids out and they tend to offer them special treats, special privileges to build trust and to build a relationship. So, two things that all parents should be making sure that their kids know is that adults should not be singling them out for special treatment. If the teacher is giving a whole class a prize, that's wonderful. But kids, if they notice that an adult is treating them differently, even if it seems like a good thing, that's something that they need to talk to their parents about. Then, what predators tend to do is desensitize children to touch and desensitize children to sexual content. And so, what that looks like is it starts with benign touch, right?
Mhm.
But if a kid ever feels like an adult is touching their body more than they would expect, that's something that they should tell their parents about. Outside of discussions with a pediatrician or health class, adults should not randomly be talking to children about sex. Adults should not be teaching about sex, showing pornography, or anything like that. And kids should know if that happens outside of an expected conversation, they should let their parents know. And then, probably the simplest and maybe the most important place to start is that adults do not ask children to keep secrets. Now,
Mhm.
a secret is different from a surprise. With a surprise, the person is expected to eventually find out and is expected to be happy. So, a surprise is making grandma a card for her birthday or baking your friend cupcakes. Secrets are different. With secrets, people are never supposed to find out, and it could usually be expected that the secret would not please them. So adults should never ask kids to keep secrets, and children should know that if an adult tells them that something's a secret, and even if they say that the child will get in trouble or that something bad will happen, those things aren't true, and they should speak to a parent or a caregiver whom they trust immediately.
Now, what are some approaches parents can discuss these issues and ask these questions and guide their children about some of the things that you just talked about? What age should they start? So, what are some approaches that would work?
Yeah, so obviously there's a developmental range. So with very young children, the places that I recommend starting are bodily autonomy. And that's very simple. And I tell parents to start when their kids are babies at bath time, not because the baby will understand them, because it helps the parent practice and become more comfortable. So, but we just start with the very basics. Your body is for you. Nobody else should be touching your body. And then it's really important to teach young children about listening to their inner voice and trusting their own instincts. And so with preschoolers, we just start there. But by late preschool, certainly by early elementary school, it any child can understand secrecy and that adults don't ask kids to keep secrets. One of my favorite parts about that is that it is messaging that applies to a 4-year-old all the way through high school. And so that should be a through line through childhood. And the nice thing about that is that I have found that it tends to come up in benign ways. And so if you make your family a family where kids always disclose secrets, then they get to practice doing that with secrets that maybe aren't that big a deal. Then, as kids get older, certainly by elementary school, any child who has access to the internet needs to have a conversation about pornography. And one of the most important things about starting these conversations is that they're creating what I like to call conversational scaffolding. Conversational scaffolding is something that children, or really anybody who's having a conversation, can return to. It provides structure, and it actually, just like real scaffolding, provides support and protection. So if a 12-year-old accidentally stumbles upon pornography on the internet, if no conversation of pornography has ever happened in that child's home, it is going to be exceedingly difficult, if not impossible, to expect that child to broach this conversation with his or her parents. Kids may not even know that parents know what this is, but If there's been a prior conversation, even if it's very simple, sometimes when you're doing your schoolwork online,
Hmm.
pictures can pop up that you don't expect, and they can even be pictures of people without clothes on. If you have had that conversation, then the child has something to reference and can say, hey, Dad, do you remember that time you told me about weird pictures popping up on the internet? I think that might have happened on my iPad today. Then, as kids get older, this transitions into, what do healthy romantic relationships look like? What does consent look like? And how does intoxication and substance use and abuse impact both of those things?
One of the other things that you had previously mentioned was building self-esteem makes kids less desirable targets, right? So, especially in the teenage years, self-esteem is a big issue for a lot of children. Talk more about how we can do that.
So I think in an ideal world, the less time our kids spend on screens and particularly on social media, the better it is for their mental health generally. But I think that parents underestimate how desirable just parental time and attention is to kids. And this doesn't have to be fancy and this doesn't have to be expensive. But when you spend time with your kids, yes, it builds that relationship, but it's also sending children a message that you, the adult, value them as people. You find them individuals worth spending time with. And just doing that, really listening, putting your phone down for the parent too,
Hmm.
just really listening to your kid and sending them the message that their attention is worthy of your time is the simplest way to build self-esteem. Then additionally, I would say tell your kids what you like, what you admire, what you see. Just hearing that messaging, parents messaging to their kids translates into becoming their children's inner voice. So we want those inner voices to be positive.
Now, let's say a child perhaps is suspected to be approached, be groomed, asked to keep secrets, and discloses it to the parent. Tell us about the next steps after a child discloses something like that to their parent.
So, adult survivors of sexual abuse tell us that the primary reason for not disclosing, because kids overwhelmingly do not disclose for a minimum of 5 years, often until adulthood, often never. The number one reason for not disclosing is fear of not being believed. And so, first of all, it is good to tell your kids in advance of anything happens. If any of these things happen, you can come to me. I will believe you. I will keep you safe. And then you need to follow through on those promises. So, the initial response, so for a parent, obviously, a disclosure like that is extremely distressing to hear. And in that moment, all the child really needs is belief and love and acceptance and protection. So the messaging in that moment is, I am so glad that you told me. We are going to get help and work this out together. Now, in terms of practical nuts and bolts, it depends a little bit about what happened. So, if there was a physical assault and there is a question of, do you need to go to the hospital for evidence collection? Because that, you have a time limited window to do that. I would advise parents to call their pediatrician. Everybody should have somebody on call 24 hours a day, or go to an emergency department because the doctors and nurses there are well equipped to help you figure out, does something need to happen right now? Most often, something doesn't need to happen right now. And so then, depending on the circumstances, speaking to the school district, the police. Again, pediatricians are unfortunately very well versed in this and know how to provide families to the right resources. But most communities have children's advocacy centers who, what they do is forensic interviewing and therapy and counseling to help families work through these events.
What if it's, say, in the very early stages, someone was just asked to keep a secret, and like you said, a lot of times it comes from someone the child knows, whether it's a teacher, coach, or relative. And it may be innocuous and may not be. So in that gray area, what do we do then?
So you train your kids to reply, thank you for whatever it is. I am going to tell my dad though, because in our family, we don't keep secrets. If this was a benign event, then that's fine. Nobody should be offended by that. However, if that is a child predator who is starting the grooming process, your child has just sent extremely clear messaging to back off and move along. Because if I am a child predator and I get that message, I hear I need to stay away from this child because this child is a threat to me. Because as a predator, I require secrecy and I operate based on shame. And it sounds like this isn't happening here.
And tell us some type of resources parents can turn to if they want to read or learn more about this.
So I am working on creating these resources because I have been really startled to see how little is out there. I am very new to social media myself, but I'm starting to put out reels on Instagram and TikTok talking about this. I'm Bronwen Carroll, MD. I also have a website and I am in the process of writing a book that will hopefully be out in 27 that will be a really comprehensive guide.
And I know this has certainly been implied, but what are some things that parents should definitely not do? Any red flags that they should not do when it comes to preventing potential sexual abuse in their children?
So I think the idea here is these conversations are meant to be empowering. I what my message is that sexual abuse is largely preventable through education. The idea is not to get, parents are inundated with all these things that they need to worry about.
Mhm.
And this is not to cause hysteria or just cause one more thing to worry about. The messaging is this is a problem that by having a family with open communication and conversations, you can largely get ahead of. I think that it is super important for parents to be careful and to understand that when these events occur, they are never a child's fault. It is not the kid's fault for finding him or herself in a situation where an adult acted inappropriately. And so when we look at adult survivors and mental health outcomes, the kids who do the best are the ones who disclose and are met with love and support. The kids who do the worst are the ones who disclose and are not believed. And the kids who never disclose are somewhere in the middle. So meeting your kids with love, with belief, with support.
We're talking to Bronwen Carroll. She's a pediatric emergency medicine physician. Today's Kevin MD article is The Childhood Risk We Never Talk About. Bronwen, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Sexual assault is the most common serious threat to kids, but by speaking to your kids about it in advance, it's largely preventable. Pediatricians and everybody in healthcare needs to be encouraging parents to have those conversations.
Bronwen, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thanks for having me.